Have you ever felt sad? Do you know the difference between being depressed and having depression? This will be the theme of this video. Depressive disorder is a serious mental condition that affects millions of people worldwide. This guide addresses the definition of the disease, its prevalence, risk factors, symptoms, diagnosis, and treatment. What is depressive disorder? Depressive disorder, also known as clinical depression, is a mental illness characterized by a persistent feeling of sadness and loss of interest in previously enjoyable activities. These feelings may be accompanied by a variety of physical and emotional symptoms that affect a person's ability to function in daily life. How common is depression in society? This is one of the most common mental health conditions in the world. It is estimated that about 5% of the global population experiences depression at some point in their lives. The World Health Organization highlights that depression is one of the leading causes of disability worldwide, affecting people of all ages, genders, and backgrounds. What are the associated risk factors? Several elements can increase the likelihood of developing depression. Genetic factors play an important role, with a higher risk in people with a family history of the disease. Additionally, stressful or traumatic events, such as the loss of a loved one, divorce, or financial problems, can trigger depressive episodes. Other factors include chronic illnesses, substance use, and chemical imbalances in the brain. What are the symptoms of depression? The symptoms of depression vary from person to person, but generally include persistent sadness, loss of interest in activities, changes in appetite and weight, insomnia, excessive sleep, fatigue, feelings of worthlessness or guilt, difficulty concentrating, and thoughts of death or suicide. These signs can significantly interfere with a person's ability to lead a normal life. How is depressive disorder diagnosed? The diagnosis of depression is made by a mental health professional. The assessment involves detailed interviews to understand the symptoms, medical and family history, and the impact of symptoms on the patient's life. Established diagnostic criteria, such as those from the Diagnostic and Statistical Manual of Mental Disorders, are used to confirm the presence of the disease. Note that it is not enough to be depressed for some temporary reason. More findings must be observed to confirm the diagnosis. Additional tests may be conducted to rule out other medical conditions that might be causing the symptoms. How is depression treated? It usually includes a combination of therapy and medication. Cognitive behavioral therapy is an effective approach that helps patients identify and modify negative thought patterns. Antidepressant medications, such as selective serotonin reuptake inhibitors, may be prescribed to relieve symptoms. Leave your suggestions for topics for the next videos in the comments. Did you like the content? Like and share. Thank you.